Welcome to our show, Hair Transplant Step by Step. Just a brief introduction about why we have started this show. Out of so many years of practice and dealing with so many patients seeking for hair transplant, we have realized that there are lots of questions and doubts to be answered for hair transplant. There is a lot of material available on internet through which patients get most of their answers. But they don't really have access to the right content, the right scientific content all the time. And that's why they end up getting misguided or end up taking wrong decisions or end up in doubtfulness or in darkness. So here with this episode series, we are trying to address to most of the doubts which can come across while you are planning for a hair transplant. You must have seen lots of videos doing the surgery, how the surgery is performed, what is aftercare, what are the results. But here we are talking about the in-depth science behind hair transplant. How to extract the hair, how to implant the hair, what are the parameters which are important for proper extraction, proper implantation, and in turn proper results. So in this first episode, we are talking about hair transplant in general. Now when we talk about hair transplant, the idea is that we are implanting new hair roots in the bald areas. From where we take out these roots? We take them out from the back of your head and put them in the front where you don't have hair. The roots at the back of the head, they are strong. They are genetically strong roots which do not fall under influence of your hormones and genes. We take that advantage and implant these strong roots in the front where in turn they stay on for a long time just because they are manufactured strong. Usually I give a simile of soil and seeds. In baldness, it's the seeds which were weak, the plants which are weak, and that's why you lost them. But the soil in the front is absolutely normal. So in a normal soil, if you implant good, thick and strong seeds, they grow back again. So first question which we usually face is, do they grow in bald areas and do they stay back? Yes, they do grow because they are strong and they do stay back because they are strong. Now there are different techniques to do hair transplant. There are mainly two techniques, strip surgery and FUE. Strip surgery is many times known as FUT or follicular unit transplant. In strip surgery, we take out a strip of skin from back of your head, dissect it into individual hair follicles and implant that in front. So while doing strip surgery, this is the back of the head, the ears and the permanent zone of hair. In strip surgery, we take out a thin strip, maybe 1.5 centimeter wide, and depending upon the length of individual's head, maybe around 25 to 27 centimeter long. So we take out this big strip of skin. From that separated strip, we dissect individual hair follicles. We separate individual hair follicles. And these separated hair follicles, we implant in the front, in the bald area. So that is what is strip surgery. This dissected area, we close it with the help of stitches. So that's why in strip surgery, patient ends up getting a linear scar and stitches to close that area. The FUE, which is called as follicular unit extraction, in this we don't have to take out a strip of skin. Instead, we take out individual hair follicles directly from the back of the head. And those taken out hair follicles, we directly implant them in the front. When we're taking out follicles from the back of the head, we are not taking them all out. We pick one, we leave aside 3 to 4. We pick one, we leave aside 3 to 4. So the ones which we have not taken out grow back again in that area and cover that area. So that's why another question which is commonly asked is, if we are taking out so many follicles from the back of the head, won't the back of the head look empty? No, it will not. There are calculations based on which we decide that how many number of grafts can be taken out in a particular person without compromising the back area, which is called as donor area. And when we stay within that safe limit, the donor area after extraction of so many numbers of grafts, 1000 grafts or whatever, it just looks the same as it was looking before the procedure. But definitely we are reducing the number of follicles from the back of the head, whatever we have extracted. They are not going to grow back again. So we are reducing the number of grafts at the back of the head. And that is why we cannot keep on extracting again and again. We don't have enough supply available every time. Whatever is taken out, it's gone to the front. So we are not multiplying hair. We are taking out and putting them in the front. Kidney transplant. You are not multiplying kidney. You are taking out kidney from one place and putting it in another place. The first place is empty. That is why in a hair transplant, how many number of grafts can be extracted? It's a very artistic decision apart from the scientific calculation. You need to judge based on the patient's hair density and growth that how many numbers can be taken out without compromising the donor area. Many times we hear that patients have undergone sessions with 4,000 extractions, 5,000 extractions, 6,000 extractions. Patients have undergone 2-3 sessions with 3,000 extractions each. Practically speaking, in Indian male hair density scenarios or even in most of the races, these many numbers are not possible. You can only attain them if you go completely blank at the back of the head. Initially, back in like many decades ago, started with FU, but that's altogether a different topic. We are not going into it. Since almost 96-98, strip surgery was the gold standard, which gave wonderful results. So yes, strip surgery do give you good results. But now with the advent of FUE, in which a patient doesn't go any linear extraction or a linear scar or stitches, can directly undergo individual hair follicle extraction and implant them in front, the hair transplantation science has grown in multiples worldwide because of the simplicity of the procedure for the patient. So again, back to the same question, which technique is good? They both are good, but we these days are performing only FUE. I personally feel that to master a particular technique, you have to keep on performing it regularly. And that regularly doesn't mean once a month, once a week. You have to keep on doing those small finer tasks on regular basis so that you can achieve a kind of expertise in that. So now we are completely focusing on FUE. We have stopped performing strip surgery. So now onwards in next episodes, we will be discussing about FUE, that what all parameters one should be taking care of when they are planning for their FUE surgery. Thanks friends, I hope that this video gave you some insight about basic of the hair transplant, but there is a lot more to come. Let's see what we talk in next episode. See you then. Bye.